Oops. Hi guys, my name is Sanjay Gupta. I'm a cardiologist. Here. My name is Sanjay Gupta. I'm a cardiologist in York. I've been very interested in the subject of palpitations, ectopics. I've done a bunch of videos, and one of the very interesting things and commonly neglected things is the relationship between reflux disease or indigestion and whether that can bring on ectopics or palpitations. A lot of times when patients go and see their doctors, no one really talks about whether reflux, which is incredibly common these days, could be precipitating the ectopic beats or heart rhythm disturbances. And through these videos, I've had a lot of great feedback from people who've written to me and say, hey, you know, I've noticed that when I get reflux, when I'm getting indigestion, my palpitations are worse on those days. And I have always thought that there was a link between the stomach and the heart. And today I thought I had a little bit of time and I couldn't go to sleep, so I thought I'd do some research and try and find out if there was indeed any evidence pointing to a link between heart rhythm disorders and the stomach. And I found a very interesting article, and this is an article entitled Atrial Fibrillation in Patients with Gastroesophageal Reflux Disease, a Comprehensive Review, and it's been written by a person called Krina Roman, R-O-M-A-N, and which was published in the World Journal of Gastroenterology in 2014. So if you want to look it up, if you go to PubMed and type it, the whole paper is actually freely available on the internet. And basically what these guys did was they looked at a bunch of studies that had tried to answer this issue. Okay, it's important to say that they were looking mainly in atrial fibrillation, which is a sustained heart rhythm disturbance. I've done a video on atrial fibrillation, but I think what applies for atrial fibrillation will also apply for ectopics or heart rhythm disturbances in general. And therefore, I think it's particularly relevant. It's important to bear in mind that gastroesophageal reflux is incredibly common, okay? And it's a disease that young people have as well as old people have. It's a disease that thin people have as well as overweight people have. It is everywhere. I have to say that in my clinic, in my heart clinic, I would say 8 out of 10 people come in on medications for reflux disease. So it's incredibly common, okay? And I think that is largely due to our diet and what we do with our lives in terms of, you know, bad lifestyle, and that's what's bringing on this reflux. But there have been, and the other thing to say is that both heart rhythm disturbances and reflux have lots of things in common, i.e., you know, they share the same kind of underlying conditions such as obesity, metabolic syndromes, diabetes, etc. So it is not uncommon for patients to have the same kind of underlying things. Sleep apnea is another thing that a lot of people have, and they often, people with reflux and people with heart rhythm disturbances have underlying sleep apnea. But the relationship between gastrointestinal symptoms and heart rhythms was first described by a guy called Ludwig Roemheld, R-O-E-M-H-E-L-D. And he described something called the Roemheld gastrocardiac syndrome, okay? Roemheld gastrocardiac syndrome, in which he stimulated the esophagus and the stomach and was able to induce heart rhythm disturbance-related symptoms. There have been a bunch of studies after that, and these guys who published this paper looked at 8 studies, and they found that in 7 of them, there was an increased preponderance of heart rhythm disturbances in people who had gastric symptoms, reflux symptoms. So it's well described that if you have gastroesophageal reflux disease, you are more likely to get atrial heart rhythm disturbances, specifically atrial fibrillation. But I'm sure that this is also true for atrial ectopics, so supraventricular or, you know, PACs, premature atrial complexes or supraventricular complexes. which would cause ectopic beats, which would cause, skipping of the heartbeat, etc. And there have also been lots of studies, again, listed in this paper, which show that if you treat the reflux, then that can be an incredibly effective way to treat the ectopics or treat the heart rhythm disturbances. So if you treat the reflux with proton pump inhibitors, so omeprazole, lansoprazole, and if you treat them for about 2 months and you get a good dose of these proton pump inhibitors in you and treat that reflux, then that'll significantly improve the atrial dysrhythmias that you're likely to have. Okay, and now the next question is, well, what is the mechanism? Why should the heart be linked to the stomach? And there are a few things that have been postulated. There are a few hypotheses. The first to say is that when you have reflux, it does stimulate your vagus nerve, okay? And the vagus nerve has an effect on the heart. The vagus nerve slows the heart down. The vagus nerve. So, if you press on the neck, for example, you can slow the heart down. That is called a carotid body massage, or you're stimulating the vagus nerve to slow the heart down. The problem with that is that if you slow the heart down, then there is an increased likelihood of extra beats happening, because you may know from my previous videos that if you increase the time between 2 heartbeats, that's when you're more likely to get extra beats. So that's one possibility. Okay. The second thing to say is that the reflux is an inflammatory process. Okay, and if you measure the blood markers, you'll find lots of horrible inflammatory chemicals to be in a high concentration in people who are getting active reflux. These include something called C-reactive protein, interleukins, etc. But we also know that atrial fibrillation is caused by inflammation. And so if you have more inflammation within the body, that will undoubtedly make the heart more irritable because of the release of these inflammatory markers. And so that's another possibility. Another possibility is that the esophagus and the esophagus and the stomach are in close relationship. They're in close proximity to the atrium, the top chamber of the heart. And so if there's any inflammation around the esophagus and the stomach, then that can also irritate the stomach, irritate the heart just by being close to it. Some people say that when you have reflux, you are reducing the amount of blood flow to the heart at that time, coronary blood flow. And if you have underlying ischemic heart disease, then that could potentially cause a degree of ischemia in the atrium, a reduction in the blood supply to the atrium, making the atrium more irritable. So that could be another trigger for the initiation of atrial fibrillation. Some people have hiatus hernias, and I have a hiatus hernia, so it's not, and I'm not particularly overweight, so it's not uncommon for people these days to have hiatus hernias. And what that is that a bit of the stomach actually protrudes into the chest, and therefore when there is acid release, that acid is not cleared out as quickly because there's a little bit of the stomach which is herniating into the chest, and so the acid can stay and burn part of the stomach. The problem with that is, so if you have a hiatus hernia, that can have a mechanical effect on the atrium and compress it and irritate it. And of course, the second thing is that if you have inflammation, chronic inflammation in that area, that can irritate the atrium. So there is no doubt in my mind that having active reflux going on in your body can trigger off heart rhythm disturbances. And it is really, really important as part of your overall treatment to try and work out how to get rid of your ectopics. I mean, it's one thing being told, well, they're not dangerous. Yeah, great, they're not dangerous, but you're still suffering with them. You're still being limited because of them. They're still affecting your quality of life. So I think it is important that doctors work with patients to try and identify things that could be bringing on these ectopic beats. And gastroesophageal reflux is certainly one of those things that you should be looking to identify And if you are found to have gastroesophageal reflux, good treatment of the gastroesophageal reflux, however well you do, however you choose to do it, whether it be that through weight loss or be that through proton pump inhibitors, good treatment of the reflux will undoubtedly reduce your propensity to get extra beats and reduce your ectopics. I hope that was useful. If you find this video useful, please, please, please consider sharing it with your friends, because the more people, there's a ton of people out there who are suffering and getting very anxious about these symptoms. And I think often such patients are neglected by their doctors because the doctor just thinks, oh, well, they're not dangerous, go away. But, you know, that doesn't alleviate the patient's anxiety. And people often get into this vicious cycle where they get the palpitations, they worry about it, and then the more they worry, the more they notice the palpitations, the more they notice the palpitations, the less, the more scared they get about things like exercising, they put on weight, they get worse. And so you can get into this hideous vicious cycle. And my aim is to try and work with you guys to see if you can identify things within your lifestyle, within your setting, which could be precipitating some of your ectopic beats. So reflux is a big thing. Please consider speaking to your GP about it. Please consider sharing this video, and please consider subscribing to my channel. I hope to do a lot more videos on this subject in the future. If you'd like to speak to me, I now have a website. Oh, crikey, look at this. I now have a website. It's yourcardiology.co.uk. If you'd like to speak to me on the phone, you can ring my secretary up on 01904725811. I'm also on Twitter. I'm going to have to do this again. Twitter, Your Cardiology, and I'm also on Facebook on, again, Your Cardiology. So sorry about this, but I hope this was useful. Thanks very much. Bye.